Hello, my name is Hans-Peter Bögl and I'm grateful for the opportunity to give you some insights in our study on operative outcomes after femoral nailing in patients with femoral shaft fractures being 55 years and older. The idea for this study arose during previous projects where we studied reoperation rates in patients with atypical femoral fractures. Back then, upon review of hundreds of X-rays, we noticed that a significant proportion of these patients were treated with standard antegrade or retrograde nails, despite the fact of being osteopenic. As you can see on this image, one of the dreading complications is a fragility fracture in the femoral neck. This appeared very counterintuitive to us. Why would one leave the femoral neck unfixated in the setting of osteopenia? When we did literature research, though, we did not find any good evidence for the preferred use of femoral neck fixating nails over others. To us, very surprising, we even found studies that would show 100% use of standard antegrade nails in the setting of atypical femoral fractures. This was why we were interested in studying this matter more deeply. We therefore designed a retrospective nationwide study including 897 patients with low-energy femoral shaft fractures that had been treated with intramedullary nails. This cohort was then divided into a femoral neck protection group including cephalomedullary and reconstruction nails, and a non-femoral neck protection group including standard antegrade and retrograde nails for comparison of outcomes. After rather cumbersome retrieval and examination of all imaging on these patients, we found a risk reduction of about 80% for peri-implant fractures and a almost 50% risk reduction for major reoperations when we calculated adjusted hazard ratios. We did not identify any specific complications for the use of femoral neck fixating nails, as in avascular necrosis or femoral head penetration. In summary, we can only strongly advocate the use of nails that include the femoral head and neck into the fixation when treating femoral shaft fractures in the elderly, as these nails effectively prevent dreadful complications like femoral neck fractures in this particular frail patient group. Thank you for your attendance.